I am Anna Stromberg. I'm a professor and a heart failure nurse from Sweden. And I'm here together with Professor Tini Jaarsma, who has led the development of the first heart failure guideline for patients. And I would like to take the chance to ask you a little bit about these guidelines. So, can you talk about why do we need guidelines for patients?
We started a few years ago, and then already, and now especially the buzzword is shared decision making. So we really want to make decisions about treatment and care together with patients. So for that, patients need to be optimally informed, and not only about what is heart failure, but also what do the guidelines say. So they have a more equal position if they talk to the healthcare professional on what could they expect for diagnosis and treatment. So it's really to empower patients to go into that discussion with their healthcare professional.
Yeah, and can you summarize the guidelines a little bit? What are like the key messages for the patients?
Yeah, so I'm not going to summarize the whole guideline, but a little bit. But I think the important is we discuss the diagnosis. What kind of diagnosis can a patient expect? So that's an important part of the patient guidelines. And also the treatment. So we talk in that guidelines on diagnosis, but also on surgery, on medications, of course, which kind of medication should the patient be considered to be on, devices, but also very important lifestyle changes and also monitoring and management. So what can a patient do themselves? So that are key elements. And then on top of all these pillars, we say we have the house, and the house is the multidisciplinary team. And that's also an important aspect of the guidelines. Who should take care of you?
And should all patients read these guidelines, and should others also read them, or?
Yeah, it's interesting because, of course, everybody needs to choose for themselves if they want to read the guidelines. But it's a very good complement to, for example, the Heart Failure Matters website. What is now the newest evidence? What does my doctor or my nurse or other healthcare professional read? So I think it's suitable for all patients. It's developed also with patients, but others also can read it. Family members of patients, but even other healthcare professionals. If they want to have this very quick outlook, what's in the guidelines, they can actually go there. And the nice thing is that you can right-click through the original guidelines.
Yeah. And just to emphasize that on Heart Failure Matters, the website for heart failure patients from the ESC, the guidelines are available. So, but we also hope that it will be spread throughout all clinics and different places also, so people can get access, so patients can get access to the guidelines. Yeah.
And I think the nice thing about this now is that we have also the updated version. So of course now it's the updated version, and it used to be that you have to wait a long time for patients then to read what is new. And we directly, at a conference where the guidelines were presented, also made the patient version of the guidelines available.
Yeah. So maybe you can just explain what is the clinical guideline for those that don't know that we update currently.
So a clinical guideline is sort of the recipe book of a cardiologist or a nurse or healthcare professional on how to optimally cook the dinner, etc. So it's a cookbook on how to treat heart failure and how to diagnose heart failure. So which ingredients, which diagnosis should be considered, but also how to do it, how to optimize medical treatment, which medication should the patient be on. And that is quite an extensive document for healthcare professionals because it's so complicated, heart failure. But it helps clinicians to make the right decision because, of course, each patient is different, but there are general recommendations that have evidence from research that this is good for a patient with heart failure. So these clinical guidelines for professionals, they lead actually our day-to-day practice.
Yeah. And now in order to help patients with this shared decision making, we also have the patient guidelines. So
yes, and it's only 10 pages, so it is really a good summary and in language that we all can understand.
Thank you very much for this presentation.
Thank you.